So this week what we are focusing on is really how we administer medications and your role as a medical assistant in administering medications. So that's going to deal with chapter 55 in your book. So I really hope that you can read that before you come to class this week. We're also going to focus on understanding how to give different medications and what those different forms are. So let's go ahead and get started here. When we talk about medication, there's several ways that they can be administered. One way is orally. And orally is where it gets put, the patient actually will physically swallow the medication. And it gets entered into their GI tract, and then it gets absorbed and transported out through the circulatory system. So those can be things such as pills, syrups, or other liquids, but it can also be medications that are sublingual or buccal. So sublingual means that it goes under the tongue and gets absorbed through the body that way, and buccal actually gets put between the cheek and the gums. So if you've ever thought about if you've ever had a cough drop, we generally try to just stick them in between, and then it gets absorbed into the rest of our body. The second way we can administer medications is topically. So that's going to go on the dermal layer of skin, or it can also be a mucosal. So it will go in your mucous membranes or your skin. So the dermal way will be things like creams or ointments, lotions, or skin patches. Mucosa will be things that go as in like eye drops, ear drops, nose drops. It can also be things like eye ointments, vaginal creams, rectal or vaginal suppositories, or sterile solutions. Now, when you're giving a topical medication anyway, either dermal or mucosal, it's very important that you wear gloves. The reason being is we don't want to absorb the medicine before it gets to the patient, so always make sure you're wearing gloves. You can also give medicines rectally by inhalation, so things like inhalers or nebulizers. And we can also give them by injection. Now, because we're medical assistants, that's how we're going to give most medications, but we don't always hear them as injections. They may also be called peritoneal. And what that means is that they enter the body, the medication enters the body outside of the GI tract. So orally goes into the GI tract, immunizations will go outside of the GI tract. And we can give immunizations a couple of different ways. So we can give them intramuscularly, which means that we give it directly into the muscle at 90 degrees. And we can give it in 4 different sites. We can give it in that deltoid muscle, which you guys have all been working with, which is the upper outer surface of the upper arm. You can give it in the vastus lateralis, which is actually the outer portion of your thigh. The dorsal gluteal, which is the upper outer quadrant of the buttocks, or the ventral gluteal. And that's actually going to be given in that iliac crest on the side of the leg. This is actually the most preferred spot for those injections because there's no major arteries or veins that would be in your way. Second way you can give immunizations or injections is through the subcutaneous route. And that's going to be right under that skin surface in the fatty tissue or the subcutaneous tissue. It's going to be smaller doses of medication, and they're really generally non-irritating. They're not going to cause any problems for the patient. Those are going to go in at a 45-degree angle, and we can give them in the back of the arm, the upper back, the abdomen, or the thighs. Those are generally the proof sites. Most of the time you'll hear things like heparin or insulin given this way. And then the final way that we can give medications is an intradermal by injection. And so this is generally used for allergy skin testing. We also use it for TB testing. That's where the medication goes under just that top layer of skin, and what you're going to look for is some sort of a reaction, an induration, or something to that effect, or a redness. You can give them in the upper back, the upper chest, the forearm. Those are all approved sites. More commonly, working in medical practice than just a family practice, you're going to just do the TB testing in the forearm. Now, before you actually start administering medications, you have to remember a couple of things. You have to do the 3 befores. What I mean by that is medication should be checked at least 3 times before you administer it. So the first one is you always check the medicine before you remove it from the cabinet. Okay, check it against the order that you've received. Second time you'll check it is before it's poured, before it's drawn up, or before it's placed in that medication cup. And the third before is you want to check the medication before you return it to the cabinet. So all 3 times before you do any of those, you're going to check the medication that you have against what was ordered. But you also have to keep in mind the 7 rights of drug administration. Any one of those that go wrong can end up with serious side effects for your patient and could ultimately wind up harming them or causing death. So always make sure you have the right patient, the right drug or the right medication. You want to have the right dosage, the right route, the right time, the right documentation, and patients always have the right to refuse. Please be very cautious of that. If your patient says no, no is the answer. Don't try to force them into it. Now, like I said earlier, most of your responsibility of administering medication is going to come by that injection or that peritoneal route. So it's really important that you understand the different forms that that medication can come in. It can come in vials, it can come in ampoules, it can come in pre-filled syringes, or powders. So vials, when we talk about that, you guys all know what a vial is. You've been playing with them in class. They're either a single dose or a multi-dose. Now, what you've been using in class is a multi-dose. That means multiple samples, multiple medications can be drawn and given from that. You know that they can come in glass or they can come in plastic. Plastic's really more preferred because it doesn't have any of the sharp contaminants and side effects that can come from that. Ampoules are something that you'll get to play with this week, and what these are, they're little glass bottles that contain a single dose of medication. The tricky part with ampoules is that you have to break the stem in order to administer and drop the medication. So it's really important that when you go to break the stem, you always use an alcohol pad or a gauze pad because you don't want to end up accidentally cutting yourself with the glass. But don't worry, I will teach you how to do that in class this week. Pre-filled syringes are what I like to call the godsend. What that is it essentially is a syringe that it already has the medication drawn up in it. It's already in there. All you have to do is put on a needle and inject the medication. Still make sure that you are checking that against what the provider has ordered so you make sure you're not giving the wrong medication. And the last form is going to be a powder. So if you have a medication that is a powder, they're fantastic because they have a longer shelf life, but unfortunately they have a downside to them. You have to actually reconstitute that medication. You have to make the powder into a liquid form. So how you're going to do that is with either a diluent or sterile water. More commonly, a sterile water is going to be used, and that's actually what we'll get to use in class as well. So once you actually have put in the diluent or the sterile water, it will create that liquid form that you can then draw up and administer to the patient. Alright everyone, so that's kind of the brief overview that I want to do for this week. I know that you can see in Angel we have that lab activity tab again. You don't have to worry about printing anything or submitting anything online. That's really all of the hands-on work that we're going to do this week. And what we're going to look at is we're going to kind of reach back to week 6, and you guys are going to have to administer an oral medication. And I'll set up a little scenario for that. But you're also going to work with those ampoules, those vials, and those powdered solutions and learning how to draw those up. Okay. At this point, you guys will be working on what I like to call random injection. So you're going to draw a random injection out of a hat, and that's what you're going to have to administer this week. So hopefully you remember how to do all those. If not, this is a great chapter to do that on because you can refer back. Also this week you have one discussion post, and what that discussion post is essentially a scenario that is given to you. So you have a patient that is a child, comes into your office, and is in need of an immunization. Your job in your post, and what I want you to discuss in the post, is how you will prepare that immunization, how you will administer it. Now, the post will tell you what you are giving, what injection. You need to know how that has to be given. So you might have to do a little bit of extra research, okay? So how you're going to administer that medication. I also want you to tell me what you're going to give for information to the parents. What do they need to know? And the last piece is talking about how you're going to document that in the patient's chart. So how you document in the child's chart, how you administer, how you draw it up, and what instructions you give the patient's parent. That's what the discussion post is asking for this week. Now, I know I didn't talk about how to document any of this in the video, but it does talk about it in your chapter, so hopefully you will at least read that part of your chapter for this week so you have a better understanding of how to document certain injections. Please make sure that your initial post is up by Tuesday with your 2 responses on Saturday. Final thing for this week is talking about your written assignment. Now, I know last week you didn't have one, so unfortunately those are back, but it's not really that hard of an assignment. What I want you to do is research the different types of medication errors and pick one that you want to focus on, okay? What you'll need to do is essentially create a little scenario and explain to us as readers what would happen if this error occurred. How could this error occur? Then I want you to talk about how it could be avoided. Now, how can you make it so that accident doesn't happen, that error doesn't happen? And then I want you to talk about if the error does happen, how are you going to handle that? Okay? How are you going to handle if you overdose the patient, if you underdose the patient, if you give them the wrong medicine, if you give it to the wrong patient? How are you going to handle that scenario? Okay? And then finish it with talking about how you're going to document that error in the patient's chart. This paper should be 2 to 3 pages long. There's no reason that it should be less than that. So please make sure that you're doing some good research, you're using in-text citations, you're using a proper reference page, and proper APA format. Remember, if you need any of those guides or outlines to help you, those are underneath all of my videos here on the course announcements. Alright, ladies and gentlemen, have a wonderful week, and I will see you on Wednesday. Goodbye.